In this segment, we're going to talk about the 7 types of ADD. In 1991, when I first started our brain imaging work, I thought ADD would have one pattern in the brain, but I was so wrong. We've actually seen 7 different types, which explained why one person did really well on a stimulant medication, while another person who had exactly the same symptoms became dramatically worse.
We learned about these types from our clinical work and doing a sophisticated brain imaging study called SPECT, which looks at blood flow and activity. SPECT basically tells us 3 things about the brain: healthy levels of activity, too little, or too much.
Here is a set of healthy scans. The image on the left looks at the outside surface and helps us see where the brain is not working hard enough. A healthy surface scan shows full, even, symmetrical activity. The image on the right shows us the most active areas of the brain. Red indicates the high areas of activity, which in a healthy scan are typically in the back part of the brain. Over the last 23 years, my colleagues and I have built the world's largest database of SPECT studies, now totaling more than 85,000 scans on patients from 93 countries. Early on, our imaging work taught us many important lessons, such as problems like ADD, anxiety, depression, and addictions are not single or simple disorders in the brain. They all have multiple types. Here are 2 people who are diagnosed with ADD who have radically different scan patterns. One has low activity, the other has high activity. Do you think they'll respond to the same treatments? Of course not. Treatment needs to be tailored to your brain type, not a general cluster of symptoms. Over the years, we've seen 7 clinically relevant types of ADD. Classic ADD, or what most people call ADHD, inattentive ADD, overfocused, temporal lobe, limbic, ring of fire, and anxious ADD. It's important to note that people can have more than one type. In our clinics, we use brain SPECT imaging to help us understand and treat our patients. But a long time ago, I realized not everyone can get a scan. So based on thousands of scans, I developed a questionnaire to help you know which type or types you may have. The questionnaire is used by physicians around the world and is found in the program materials. Of course, you should always talk with your healthcare professional first.
Before Daniel talks about the types, let me share with you a little about how the brain works. There are 3 common neurotransmitters that are relevant to what we are going to talk about, including dopamine, which helps with focus, motivation, and getting things done; serotonin, the don't worry, be happy chemical, that helps with mood, sleep, and being flexible; and GABA, which helps to calm the brain.
Classic ADD is the first type and is thought to be caused by low dopamine levels.
Here people have the hallmark symptoms of ADD, such as short attention span, distractibility, disorganization, procrastination, and poor impulse control. In addition, they also tend to be restless and hyperactive. They have trouble sitting still, even as adults, and tend to be pretty impulsive. The first patient you ever scanned had classic ADD.
Sally was admitted to the hospital for suicidal thoughts after having a fight with her husband. As I got to know her, I thought she had ADD. She dropped out of college despite having an IQ of 144, and she had a hyperactive son, which is a frequent tip-off that one of the parents has ADD. Plus, she was restless and pretty impulsive. But when I talked to her about ADD, she didn't think it applied to her because she could concentrate if she was really interested. So I decided to scan Sally, once at rest, and then again while she performed a concentration task.
At rest, Sally had a healthy-looking brain, but when she tried to concentrate, her brain really dropped in activity, especially in the front.
When I laid the pictures on the table in her hospital room and explained them to her, she started to cry and said, "You mean it's not my fault?"
Something we hear a lot.
"Right," I said, taking the glasses I wear to drive out of my pocket. Having ADD is just like people who need glasses. People who wear glasses aren't dumb, crazy, or stupid. Our eyeballs are shaped funny, and we wear glasses to focus. Likewise, people who have ADD aren't dumb, crazy, or stupid. Their frontal lobes shut down when they're supposed to turn on, and they need help to turn them back on so they can focus. In fact, as you can see, the harder you try, the worse it gets.
This helped Sally make sense of her life, and she had a wonderful response to the treatment. She felt calmer and more focused and went back to school to finish her degree. Her relationship with her husband and her son were better, and she no longer thought of herself as a failure, but rather as someone who needed help for a medical problem.
When you understand ADD this way, you realize that not treating it really amounts to neglect. It's like withholding glasses from someone who cannot see, and that's not fair. Classic ADD tends to respond to interventions that boost dopamine, such as stimulating supplements or medication. Exercise can help, as can a special diet, which we'll talk about later, and a specific type of omega-3 fatty acid called EPA. The good news is that with the right treatment, we can calm the restlessness you feel and improve your focus.
Inattentive ADD is the second type. People with this type have trouble focusing, but they're not hyperactive or terribly impulsive. They tend to be more introverted. Inattentive ADD is more common in girls and is often missed because people with this type tend to have fewer behavior problems. Their SPECT scans also show low activity, especially in the front of the brain. One of your daughters had this type, and until you figured it out, she really struggled.
Brianne was a very sweet child, but my fear was that she wasn't very smart. I hate saying it, but that's how I felt. I had to teach her the same concepts over and over, and she didn't learn her times tables until she was in the 5th grade. But one of Brianne's strengths was that she worked really hard. In fact, in 8th grade, she won a Presidential Scholar Award, not for academics, but for effort. To that point, Brianne had never gotten even one A in her life. In 10th grade, things started to fall apart. She was staying up every night until 1 or 2 o'clock in the morning to get her homework done, and she was starting to get depressed. Then one night she came to me in tears and told me that she thought she could never be as smart as her friends. It broke my heart. When I scanned her the next day, she had overall decreased activity in her brain. I cried when I saw it. I had helped so many children with ADD, and my own daughter was suffering with it. I put her on our treatments right away. Then 24 hours later, I rescanned her, and her brain looked so much better. Within a few days, she noticed a big difference in her focus, energy, and memory. 3 months later, Brianne brought home straight A's, and her self-esteem soared. Usually a shy kid in class, because she was usually lost, she started to raise her hand. One night at dinner, she winked at me and said, "I kicked butt in a debate today, Dad." She went on for the next 10 years to get virtually straight A's, and Brianne got into one of the best veterinarian schools in the world. I'm scared to think what her life would have been like without this information. Don't feel bad if you've missed this in yourself or your child. I'm a board-certified psychiatrist, and I missed it in someone I love, which is why I developed a questionnaire that anyone can take at home.
Inattentive ADD also tends to respond to treatments that boost dopamine, including a higher protein diet and stimulating supplements or medications.
We call type 3 overfocused ADD. These folks have most of the ADD features, but rather than not being able to pay attention, they have trouble shifting their attention, and they tend to get stuck into loops of thinking.
In order to focus, you have to continually shift your attention. If you get stuck on a thought, it's impossible to follow what others are saying. For example, if your husband says something that irritates you, and you think about it over and over, You can't hear anything else that's being said, and you look totally inattentive.
The underlying brain pattern is different from classic or inattentive ADD. Here, both serotonin and dopamine tend to be low, and there tends to be too much activity in an area called the anterior cingulate gyrus. Think of the anterior cingulate as the brain's gear shifter. It helps you go from task to task, move from idea to idea, be flexible and go with the flow. This is the part of the brain that is also involved in error detection, or knowing when something isn't right.
When the anterior cingulate works too hard, people get stuck. They worry, hold grudges, and if things don't go their way, they can get very upset and sometimes even explode. On the surface, they can appear selfish, but they really aren't selfish. Their brains are inflexible. They can also be argumentative, oppositional, and tend to see too many errors, which can be really irritating. Do you know anyone like this? People with this type tend to have family members who also tend to get stuck on worries, grudges, and fault finding. The holiday dinners can be loads of fun.
One question to identify this type is how many times out of 10, when you ask someone to do something, will he or she do it the first time without arguing or fighting with you? If the answer is 3 or less, think over-focused ADD. It's also really interesting when you pair a classic ADD man with an over-focused ADD woman. He will say impulsive, stupid things that hurt her feelings, while she'll never let go of any bad thing he's ever done. Do you know any couples like this?
People with over-focused ADD do best on supplements or medications that boost both serotonin and dopamine, and do not do well on higher protein diets, unlike the other types. It can actually make them mean. So we just have to get your diet right, because with help, you can feel more focused and less worried. The fourth type is called temporal lobe ADD, and it is so interesting. They have the hallmark features of ADD, plus symptoms associated with problems in their temporal lobes, such as issues with learning, memory, and temper outbursts.
Chris had a long history of being hyperactive, impulsive, and aggressive. At 6, he was put on a stimulant medication, but it made him even more aggressive, and he started to hallucinate. At 8, another doctor tried him on an antidepressant, which also didn't work. By the time I saw him, he had been in family therapy for years, but the therapist blamed the mother as being the biggest part of Chris's problem.
His mother was very frustrated because she had no idea how to help her son.
I saw Chris after he attacked a boy at school with a knife when he was 12. Given his history, I ordered a SPECT study, which showed a dangerous combination of low activity in Chris's left temporal lobe, an area often implicated in violence, and low activity in his prefrontal cortex, decreasing his impulse control.
The treatment for temporal lobe ADD is supplements or medications that boost GABA to stabilize the temporal lobes. Then something to boost dopamine to help with focus. In that order. If you get the order wrong, you can hurt them. That is why in our program, knowing your type is so important. In addition, a higher protein and healthy fat diet can help. Within a few weeks of treatment, Chris was a dramatically different child. He was happier, did better in school, and the aggressive outbursts stopped. His mother no longer looked like the problem.
6 years later, I gave a lecture at Chris's high school. When he saw me on the campus, he ran up to me and gave me a big hug and introduced me to 5 of his friends. What do you think would have happened to Chris if I hadn't figured out he had temporal lobe ADD? It's likely he would have been in jail, multiple psychiatric facilities, or dead. His mother would have continued to feel shame as if she was the cause of his problems.
Look, I am the first one to say people should be held accountable for their behavior. But looking at his scan, Chris clearly had brain issues, and it's unfair to blame him or his parents for his behavior any more than you would blame someone for having cancer. We often feel sad when we think of all the people like Chris who never get the help they need. They get labeled as people who need punishment rather than help. If you see these symptoms, now is the time to get help for them before they hurt someone else or themselves.
Type 5 is what we call limbic ADD, where we see the hallmark symptoms of ADD, plus they tend to be sad, negative, and see the glass as half empty. They tend to struggle with their appetite and often feel socially isolated. In this type, we often see that the limbic or emotional brain works too hard. This is the part of the brain that is involved with setting your emotional tone, how happy or sad you are, and being connected to others. Limbic ADD tends to do well with supplements or medications that both stimulate the brain and help your mood so you can feel happier and more focused.
The Ring of Fire ADD is type 6. These people tend to be moody, easily distracted, have too many thoughts, and they're really sensitive to lights and sounds. It's as if the world comes at them too fast. This is where the brain is significantly overactive. That looks like a ring on scans.
Stimulants alone usually make this type worse. And here's the problem. Nearly all people who get diagnosed with ADD are started on stimulant medications, where these patients really need strategies to calm their brain.
That's why stimulants have a bad reputation. It's not that they're bad. They're so helpful for the right type of ADD, but can be a disaster for the wrong one.
Here's an example. Jarrett was diagnosed with ADD in preschool. His mother said he was driven by a motor that was revved way too high. He was hyperactive, hyperverbal, restless, impulsive, and couldn't focus. He also didn't sleep and interrupted everyone all the time. His third grade teacher said he would never do well in school and his parents should lower their expectations. He'd seen 5 doctors and was prescribed 5 different medications for ADD. All of them made Jarrett worse, triggering mood swings and terrible rages. He put holes in walls and scared his siblings. He had become so bad that his last doctor wanted to put him on an antipsychotic medication. That is when his mother brought him to see us. Jarrett's brain scan clearly showed the Ring of Fire pattern with dramatic overactivity. No wonder stimulants didn't work. It was like pouring gasoline on a fire. Our published research shows this pattern is made worse by stimulants 80% of the time. On a group of natural supplements to calm his brain, Jarrett did so much better. His grades improved, the rages stopped, and he was able to make friends. Now he has been on the honor roll for 2 straight years. His parents are grateful to have finally found the correct treatment plan for him, which has completely altered the course of his life. There is no telling what the future held for Jarrett if he had stayed on that previous course.
It's possible that the Ring of Fire ADD can be related to bipolar disorder, what used to be called manic depressive illness, or some form of allergy or inflammation in the brain. We treat this type with a special diet and supplements or medications to calm the brain by boosting both GABA and serotonin in that order, so people feel less frazzled and more settled.
The last type is anxious ADD. These people have most of the hallmark symptoms of ADD, plus they tend to get anxious, nervous, tense, and predict the worst. They generally don't like to speak in public, freeze on time tests, and often have lots of physical symptoms such as headaches or stomach aches. Generally, there is too much activity deep in the brain in the areas often involved with anxiety. This type tends to do well with deep relaxation techniques such as meditation or hypnosis, and supplements or medicines that balance the brain and boost both GABA and dopamine. We help them achieve a relaxed and focused state. Stimulants alone usually make these people more anxious.
I have a combination of overfocused and anxious ADD. As a child, school was a struggle and I had to work really hard to keep up. Yet my anxiety kept me doing well, but I felt chronic stress. In my 20s, a doctor put me on medication to lower my anxiety, but completely missed the ADD. As a result, it made me impulsive, and I didn't care about consequences, which was a potentially dangerous combination and could have ruined some really special relationships.
Clearly, ADD is not one thing. Knowing the type or types of ADD can make a critical difference in helping someone, and it's really not that hard. Think of classic ADD as the hyperactive child or adult who can't sit still and is always on the go. Think of inattentive ADD as someone who is shy and more reserved yet still can't focus. Think of overfocused ADD as someone who gets stuck on bad thoughts. Temporal lobe ADD is someone who may be more temperamental and struggles with learning. Limbic ADD is ADD and SAD, the ring of fire type where there is way too much going on in their brains. And anxious ADD where someone has both anxiety and trouble focusing.